Do I need to prime my pen for every injection or just the first one? Okay, another really good question. And obviously relevant to the weight loss injections, not tablets. So again, as I've mentioned, if you hadn't seen them before, the medication comes as a pen. And honestly, if you're thinking about starting the medication and you're worried about injecting yourself, number one, the pens are really easy to use. Once you've done the first one and you've got the knack, you're absolutely fine. And you know, you're away you go. And it's what's called a subcutaneous injection. So it's just going into the fat layer under the skin. So you've only got to go a couple of millimeters into past the skin to get into the subcutaneous fat tissue. As I say, if you can pinch an inch, that's a good place to inject yourself. And the needle is so thin, you know, it's almost the width of a piece of hair. You know, it's a small needle. It's not like a big needle that you might have a blood test done with. And again, if it's more than a little tiny sharp scratch when you inject yourself, I mean, some people say they don't even feel anything. It really isn't a daunting prospect. And once you've done it once, it's only once a week, you'll find that you're used to it. Sometimes people ask somebody at home to do it for them, a husband, spouse, partner, you know, whoever you have at home that can also do it for you, potentially, if you feel a bit nervous the first time injecting yourself. So the first time you use the pen, you do have to do something called prime it. And what that essentially means is you just need to make sure that the liquid, the medication, comes out the pen, because you don't want to be injecting yourself and nothing coming out. So the pens always come with a little bit of extra medication in them to allow for this. But you only need to prime the first time you use the pen. You don't need to do it before every dose. Again, depending on whether you're on a Wegovy pen or a Mounjaro pen, essentially you put your fresh needle on. Important, use a fresh needle every time. Fresh needle on the pen. You turn the dose selector just a small amount, and then you press the button on the end which dispenses the medication. And what you should see is a small little jet of medication coming out of the end of the needle, or maybe just at the end of the needle, a little droplet appearing. And that tells you the medication is flowing through the pen, and go ahead and do your injection. Sometimes you might have to do 2 or 3 primes to see it come through. Again, don't be afraid of that. There is extra medication in the pen to make sure that you can do that process, and then you're fine to inject yourself. But no, you don't need to do it every time. And as I say, it's a really good idea to make sure that you change the needle every time. If you buy Wegovy, it comes with the 4 needles that you need. Mounjaro, we supply you with those needles, so there's no need to worry, you get those needles. Sharps as well. So obviously we don't put needles in the bin, the regular bin, because your poor bin man might end up stabbing himself with your needle, and that's a contamination risk, and also not very pleasant for anybody else in your own household either. So you always get a sharps bin to dispose of the needles. So after you've used the needle, you just put it in that sharps bin, and when that sharps bin is full, that's the time to get a new one or to get rid of it. And there are lots of different ways you can do that. If you're a patient of ours, we are happy to take it back, and we can give you a free post envelope to do so. You can contact your local council, you can walk into a community pharmacy. There are lots of ways that you can get rid of your sharps bin when it's full, and then it's appropriately incinerated and dealt with in terms of your clinical waste. In terms of your pen, again, you want to make sure you're disposing of it correctly, and there's actually some great pen recycling schemes that again make sure that the pen can be disposed of correctly, and we aren't putting medication in the regular general waste.